Our first conversation is about national security and not the hard journalistic whatever you've had all week. Let's try to give ourselves some perspectives, that'll help us all to take positions. I've been concerned, Joke, about the fact that over the years, when we talk about insecurity, we're talking about it like it's only something we have to deal with now. And we are not factoring in the next generation, who are already, I talked about them earlier, in their youth service year now. They get into the work environment and then they have to be learning these things. Anyway, quick update. President Bola Tinubu on Wednesday declared a nationwide security emergency, ordering an unprecedented surge in military and police recruitment as kidnappings and terrorist attacks sweep across multiple states. The police will be recruiting 20,000 additional officers, raising the ongoing drive to 50,000, and authorized the military and Department of State DSS to enlist thousands more. This was some kind of part of the campaign, should I say, promises the president has said to happen. Now it's activated,
activated quickly
too.
Yeah,
the president also said, look, all VIPs and what have you attached to everywhere. All pulled back.
I watched some events over the weekend. You don't see...
No policemen, no orderlies.
No orderlies, wow.
And the IG revealed that there are more than 11,000 that have been pulled back into the police force. And I'm wondering, well, we are grateful to God for that. But there are those who are also saying the police is going to be losing a lot of money from that. Because, but anyway, you know what? It's a presidential order. There's nothing that you can do about it.
Security concerns. Well, and they will get a boom from this.
Yes. Whether or not they're even licensed to do some of those things for VIPs is another conversation altogether. But let's look at certain things. As I said earlier, Joke, there are some things that we have tried before that worked. The JTF, Joint Task Force, with the military, the civilian JTF, they call it, and all of that. So did that work really? Were there oppositions? Were there issues with it? Then there are some that we never tried. And then there are some we started. I'm not sure how wonderfully, if at all, they're working. And that is the issue of constabulary. That the police IG at some point, I don't know whether it was this IG or the previous one, that said that we have some police constables in the local communities. Whether that is working or not, we'll find out. And then the one that we have not tried, that we've been talking about for years, is state police.
Yes.
And yes, so let's have conversations around that this morning with two of our guests, but one of them is with us in the studio this morning. Buduka Johnson is a security expert and MD EPSS. Thank you so much for your time this morning.
Thank you so much for having me.
I read an interview where you described what you had to do when you were, for want of a better word, a victim of kidnapping yourself. Tell us what happened and how did it go? Because one of the things that I'm hoping we'll be able to do, which people have had issues with, I don't know if you're aware of, is that trusting information to the hands of security agencies gives some other people problems. So give us a perspective on that.
Okay, thank you so much for having me again. And it's nice to relate this with what we're discussing. And so when my mom was kidnapped at 2 a.m., I got a call from the village. And by that time, the C4I was already in operation in River State. And I just dialed the number 112. And as soon as I dialed the number, someone picked up. And I said, oh, my mom had been kidnapped. And immediately, the police made their way. Half an hour later, from the village, the police called me. They had arrived at the village. Wow. So it was a system put in place by the governor then, And
how far back was this?
2010.
Okay.
Yes. And what we have with policing, and there were investigations. We made investigations and asked the community what they saw at that night. And we were told there was a gold car. So that's why you see that community information is very important. Someone just said, oh, we saw a gold car at 1 a.m. that night while we were coming from another village. So that was an information.
Yeah.
And then how you then use the information when it was time to give the ransom. On the delivery of the ransom, I was asked to go deliver the ransom, and I was worried. But by then you see that there was another company, telecom company, who was doing tracking. We could track the position where these people were, and we knew the coordinates, of their area. And when we finally decided to meet somewhere, on our way there, we saw a gold car. So because there was already an information, telling us there was a gold car
in the mix somewhere.
Yes, we marked it, and we knew that they were connected.
Yeah.
So I think that helped a lot to dissect, then we had the anti-kidnap unit. It was working. Then we had the law. The River State made a law and put a penalty on kidnap. So all these things were working. So about continuity now, which is our problem, so the shift in the security strategy comes with every new administration, and that was scrapped, so we have maybe wastage of some kind of implementation that would have, continued. So it's a continuation of those initiatives that's part of our problem.
Why do you think, it happens in that way, that we lack this continuity? Why does every government have to prove that, it has its own
originated
policies,
something,
or it originated? Why can't we have a situation where we say, this was in place before our government came into power? We saw that it worked.
And then we sustain it.
Or you hold a town hall meeting. What do you think worked with the previous administration that we should continue? Things like that. So, why do you think that happens?
I think you and I would want to reason why it happens. But, politically, people like to, like the governors or the leaders or the politicians like to, allude some kind of victory to themselves. I can't tell you what's on their mind, really. But I can say for sure that it's taking us back a lot of the time, because Timor Reeve was set up to deal with the transportation. And then after the next administration, that was scrapped. So you have funding, and you have a lot of the people employed back in unemployment. So that creates extra, insecurity. And I just want to show one thing that says, Social Security is key to peace and security. So whatever happens to Social Security, which is the responsibility around the government, has a lot to do with the peace and security and insecurity.
I'll follow up on Joker's question this way.
Okay.
One of the things that I'm curious to find out on this program, I'm hoping that our next guest, who is a former police DIG, will join us, is if we had strategies that worked before, what political expediency would make us jeopardize the stability and security of lives and property simply because we want to score a political point? Here's what I mean. Because it is possible to sustain these things. In 1979, the government of Obasanjo, as head of state, started what they called Operation Sweep. Operation Feed the Nation was an agricultural program. Following that, there was the Shagari government. Shagari didn't want to call it Operation whatever because it's not a military government, so they changed it to Green Revolution. But guess what? 4 years down the line, when the Buhari government came into power, that project was gone. Now, in the wake of this republic, the Lagos State was having serious security challenges with armed robbery and all sorts. Before 1999, it was the Buba Marwa government in Lagos. He started what they called Operation Sweep. Operation Sweep was an anti-robbery and anti-crime, whatever, security apparatus. When this government came in, when the Bola Tinubu governorship government came in at the time, they changed it from Operation whatever to Rapid Response Squad, which it still goes by today. And people still say it's one of the reasons that there is relative security in Lagos. So if these templates have worked before, and I'm sure there are other examples all over the nation, why is it difficult for us to say, look, you know what, I can still score my political point by just putting a new sheen on this one? The civilian JTF in Nigeria worked in the Northeast, unless there is some information that we are not aware of. So how come we're not hearing that anymore, such to the effect that we are not hearing all kinds of vulnerabilities?
Okay, you've said a whole lot. Okay, let's begin with, okay, what works? Let's start with the community policing. You know, the implementation has been very difficult, but you have seen like some pilot states like Lagos, Kano, Enugu. It works because they followed through. But there has to be a political will. And, you know, you have leadership that don't really care about rule of law and then the people. If you have the people as interest, let me even take you back in 1986 when the National Security Organization was abolished. That was the same year other agencies were created, as well as a Private Security Act, which is the Act Decree of 1986. And that was for internal security. And the purpose was that the guards would give information to the police. So there was a connection to all of that structure that was, you know, done by the then military head. So they looked at national security holistically and domiciled that law in Ministry of Internal Affairs. So over time or over the years, a lot of the security events have changed. They have even domiciled the regulation now on civil defense as a department. So the private security sector is under a department in civil defense, but the authority for licensing is the Minister of Interior. So now you see that we need to bring in a lot of all the other activities that happened in the sector, which is no longer just guards. There are other activities that happen in the private security sector. So it's left for the government to look holistically at all of these societal, you know, connections, the entire national security. If you have read the 2019 National Security Strategy, the private security companies were not even mentioned. But meanwhile, we're in every local government of the nation. We're providing security solutions to facilities, both government facilities and infrastructure, you know, that belongs to IOCs. So we're everywhere. So it takes a government who is serious to see where this is going, to look holistically at all of, you know, all of the activities and then regulate properly and then reenact a new law, which is an outdated law.
Okay, right. Right. Do you think, you know, with all that you've said, if we're to implement this and bring all these factors in, all these things that have happened in the past week, 2 weeks, Kebbi kidnapping, Niger kidnapping, Kwara, you know, and then pockets of others, you know, across countries, those we don't even hear about in the news. Do you reckon that we should factor in all these things, or if we had done so, we won't really have so much of these security issues taking place, even with the private security arrangements as well?
Okay, so the law has a requirement, which is every security company in Nigeria, we're like 1,450, even if the data is not, you know, public. Every security company has 2 retired government security forces within the company. That is a requirement for you to own a security company. So these companies have built, you know, capability over time. So when you're talking about a sector that employs 4 million security guards, you know, we're not the only country in the world that operate private security. So they should be armed. And that arm should be regulated in such a way that they would then provide that security for the VIP, which I commend the president for. I believe that there was a holistic, review of the entire system for him to have made that pronouncement. So there is a gap now. There's no better time for a paradigm shift than now. It's a decisive, solution that we have to look at integrating every part of these security activities. Because, I mean, you see a country that have invested so much in the ex-service people. They've had a lot of, professional training, and the country has done so much to make them become that professional that, they are. So they should be used, wisely within the private security sector. And if police also, which is police activity is public activity. If they close all of the gaps that we're doing, that they've left by using 11,000, like you mentioned, for VIP. If they close those gaps, send those police people to the communities, you will see that those gaps or those corridors that have been left open for the public will be filled in, and then we would have the private security do what South Africa is doing and do what other countries are doing with private security.
So let me be clear. I just want some clarity. So you're saying that on the average, there are 4 million soldiers that we have not activated. I mean, I'm talking about the security, the private security people. That's what you're saying. And you're saying also that we have all of these people all over the nation. Is it possible to have had them in those schools in good numbers where we had all these unfortunate incidences? Do you think they could have been able to prevent all of the kidnappings?
With a gun, yes, but not with batons, because we currently use batons and whistles. So with guns, yes, we will be able to, do that. They would have special training. They will have a regulation. In fact, the entire bill for the private security sector will then be met with, let's say, international best practice. Yes.
So, okay. Now, that's one of the things that one of the instruments we have that we have not been using. Now, there are those who would listen to what you're saying, functional as it sounds, and say, maybe this is not so realistic. Because on the one hand, you say you have the private security forces are expected to have retired security personnel, among them at least 2 of them. How much really do you think those could have done that? Those who would wonder and say, look, those are just political or maybe just corporate positioning. They may not be as operational in their interface with the people that you have to employ.
Well, guard service is not the only activity in the private security sector. Okay. Firstly, we must identify that. So we have guards, and then we also have people who are technically, sound. If you open up the sector with that new bill and create enabling environment for all the retired service personnel to function in that sector as a consultant, as it would be very beneficial to the national security.
Is that to say that the community police initiative of the federal government is not likely to be as effective as, or do you think maybe it's in the approach to it? You cited the 2019 security strategy, and yes, indeed, even though private security was not mentioned, one of the things that we were told that the security architecture from that 2019 was going to be more people-centric than government-centric. Whether or not that's played out, I'm wondering which one, where do you stand?
Okay, so the minister, in fact, this is the first minister, Honorable Olubunmi Tunjojo, that knew his assignment as the authority for licensing. Because the Act says the minister shall appoint an officer to recommend for licensing. And that officer used to be domiciled in the Ministry of Internal Affairs and then passed now to Civil Defense. So he's on the verge of implementing that bill review, because we've had stakeholder engagement. We've had to meet with civil defense, with the ministry and the private security sector umbrella, which is, we have an association called Association of Licensed Private Security Practitioners of Nigeria, and we're all organized under one umbrella. But that's not the only activity in the sector. We're just 20% because we're connected to the Act of 1986. And you know that Act was just for internal security. So that meant they looked at internal security as part of, the solution. Like I said, that Act said the guard should give information to the police. So if you have over 700 local governments and you have security guards in largely part of it, they would give, but there has to be a communication and command and control center, there is.
But I'm still a little concerned. So there is talk of community policing. There's talk of state police. Now, you hold the private security system, and you have also spoken about the fact that there is a need for that cooperation between private security and government officials. But then, how easy has that been, particularly in the light of the fact that all we have heard about about community policing is just community policing is coming, or we are implementing it, or whatever, but it's really not as active. How would it work? In your own opinion, what are the gaps that you think we should be filling with that? I love the fact that you said that intelligence from the communities is very, very important. Yes. But where the information is not actionable, that's where some people usually have problems.
Okay, so the solution is not, it's multi-layered. So that's why it has to be an integrated solution that has all these things that we've discussed today. So yeah, the community policing has been tested in Lagos, Kano, but it hasn't been domiciled or scaled nationally, probably because of lack of will from the other states or funding, because funding is major, because you have to have equipment, you have to be able to give, and then the laws too that guard the community policing has not really been implemented properly, so that's just the issue here. And when you then want to implement it, you have to look at the reporting, what happens around it.
All right. Well, I guess now that we have heard it, the president has made that pronouncement, yeah. And the police is also kind of gearing up to align. So on the one hand, is they have 20,000 policemen to employ. On the other hand, the military has their own, personnel as well to employ. The question then would be, what is your perspective, and then we can close on that, on how we engage this policemen, 20,000 from all over the nation, in a way that would help to change the dynamics as opposed to just following the same routine? If you can hazard a perspective as to between how we have engaged policemen before and trained them into the force, and how we should be engaging them for the future.
Okay, thank you. So, firstly, we must also look at the big picture in this, in this solution. The big picture that has to do with national security, Nigeria as a country. We must demilitarize the country, because the military has their role to play. And then the police, both the ones that, are coming in as new injections, have to be posted to those communities, because they are the, let's say, the implementers of community policing. They have to then be posted, deployed, trained, and the Police Trust Fund, we were hoping that it would have maybe done a little justice. But so far, because we don't have data on how the monies were used or how the equipments were procured, there is no accountability. The government has to look at those things and see how best they can then professionalize that sector, and they have to reform the sector. So it's not just funding that is a problem, it's to reform the sector and engage them properly and deploy them properly.
You know, it's a long conversation.
Yeah.
I was hoping that we'll have the former police DIG in the studio, because he has quite some perspectives about and experience about this community policing thing. I guess we'll have to talk about it some other time, because there are some other perspectives that have come about this issue of state policing, that with state policing has to come state prisons, state, laws of police, state judiciary, and it's a whole gamut, because the police cannot just be in isolation. There are some other ancillary services that have to come with it.
So if you want to have my take, I think a hybrid solution will be good, where you have federal police, state police, and local policing, and all will be under one commission, because really jurisdiction will be a problem. Now, will a state charge someone in the federal? How would you handle that? So jurisdiction will have to be defined. Everything will have to be defined. But if they're under one commission, so we don't have that fear of maybe local government or maybe state governors using politics to weaponize, the state police. So it has to be done in such a way that we look at all the issues in that hybrid solution, and they will have the same commission.
I have to thank you very much for this morning, for your time this morning. Ms. Budika Johnson is a security expert as well, MD of EPSS. Thank you again for your time today.
Thank you so much for having me.
Thank you for sharing your experience. Okay, I understand that one of the things that have to happen from time to time is we talk about physical health and all. We don't talk about health security.
Yes, health security.
Perhaps it's a way to put it, because health financing is one way to guarantee that health will come. So let's see if we can have that conversation right after this timeout.
We're talking health now, health financing, how to stay healthy, how it can be paid for, and a lot of things that the government is doing to ensure a healthy population, and a way to ensure that the sector is well funded as it should be. The Lagos State government has launched a major milestone in its health sector financing reforms and transformation agenda with a formal unveiling of the Lagos Health Partnership, that's the LPHP, a reform initiative designed to restructure health financing, expand insurance coverage, and ensure equitable access to quality health care for residents. That's a very important factor, through a unified, transparent, public-private collaboration framework. So which means that everybody is involved in this, including the people that are getting the access to health care services. We have our guest in the house this morning is someone that everybody knows, Professor Akin Abayomi, Commissioner for Health, Lagos State. He joins us here. It's a pleasure having you on the show with us. Now, delivering the keynote address on behalf of Lagos State Governor, Mr. Babajide Sanwo-Olu, the Secretary of the State Government once described the LPHP as a historic step towards building a resilient and future-driven health financing architecture capable of protecting households from catastrophic expenditure. I think that she delivered that structure, but it's a mandate of the entire government to do that, and is the backbone. Some of the backbone of this work comes from Prof sitting right here with us.
So I'm curious, perhaps, to fire the first salvo.
Yes, certainly. Go ahead.
It's a private health financing partnership. Beg your pardon. Private health partnership. First of all, what does that mean? We'll come to the Lagos part later.
Yes.
Yeah. So essentially, we're not really an insurance culture. And so we're trying to change that narrative. And we were very excited when the federal government released the law in 2022 under Muhammad Buhari, the National Health Insurance Authority Act, which made a fundamental change in the way we look at insurance. And it stipulates simply that from 2022, it is now compulsory for all Nigerians to have a baseline health insurance, which is what we describe as social health insurance. It's a minimum package of health services, which we prescribe for everybody. And so the law, for the first time, made it mandatory. And so Lagos, who has been looking forward to this amendment in the law, was very quick to jump on this law. And Mr. Governor, within a matter of a year, released an executive order domesticating the NHIA Act, meaning that Lagosians now must pay attention to this emphasis on mandatory nature of health insurance. But the law said something very interesting. It said you must have social health insurance before you have any other insurance. So for people who have private insurance, it now compels them to hold their private insurance on one side, and then you must go and buy a social health insurance. So for us in Lagos, that's called Ilera Eco, which is a very minimum subsidized package. It's 15,000 naira. It covers very basic primary health care, family medicine. Do you have a fever? Do you need antenatal care? Do you need simple blood pressure, diabetes, those kinds of things? Doesn't cover anything sophisticated. So someone holding a private health insurance now is now faced with the law that says for you to be legal, you need to have social health insurance. So what we did through the executive order was to make life simple. If you already have a private health insurance delivered to you by an HMO in the private sector, what we're just doing is to make sure that that private health insurance clearly includes the components of the basic healthcare package, which is what we describe as the social health insurance. Now that makes you legal. So we're now combining public health insurance with private into one entity, fusing, because they were fragmented before, we're fusing them now into one entity, and we're making life easy. Those that want to carry on buying social health insurance, it's fine, it's available, and we're promoting it as fast as we can. Secondly, those that have private health insurance, you don't need to go and purchase a second health insurance because we give you a compliance of certification that you now comply with the law.
So just a second, I just want some clarity.
Yeah.
Because private health insurance is what we had before? Is that what you're saying?
No.
Like your HMO system,
yes,
that's that.
Yes.
So the social health insurance, how does it differ, if it differs, from the standard HMO that many people are aware of?
Okay, so the social health insurance, as I said, is just one package. It's very basic. It's what you need for maybe 60, 70% of your health needs.
Oh.
Right. It's regressive in the sense that it's flat. It's one premium. It doesn't change. No matter what your salary is or what your status is, you just pay this flat amount. Whereas a private health insurance is graded. There are different tiers of premiums, and you can choose. You can go from a basic to a very sophisticated. And as you increase your premium package, you get more services, and your premium value goes up. All right. So people who want private health insurance, what the law now says is you first have to go and buy a social health insurance, and then get your private health insurance on top of it.
So first you get the basic.
First you get the basic.
And that is compulsory.
That's compulsory.
Right. So the private health insurance issuers, are they compelled to ask for the social health insurance before they sign you up for their own package?
Well, that's what the law says, but you know, that would be cumbersome because you would now be operating two insurances with the administrative cost of two insurances, which is significant. So what we've done in Lagos is to fuse them.
All right.
So if you buy a private health insurance now, the social health is embedded.
All right, okay.
And then you get a certificate of compliance. You need one insurance, you're compliant, ease of doing business, you carry on.
So you can play both. You play both sides. You can. Yeah.
I'm sorry. I really am sorry. I still want clarity because you said earlier that if you had the private security, and they don't contain the social security elements.
That's beforehand.
The social health security
Insurance,
elements.
yes.
You are compelled to go get them.
Yes.
Okay. So it goes back to what Joke is saying. Because there are some things now, if you don't have your NIN, you can't get that service from government. If you don't have your BVN, you can't get that from government. So can we say that this social health program is something like that, that you are compelled to get it because it is a standard to ensure you are alive and well?
So this is where the second part of the executive order comes in, because a law without enforcement really is just a piece of paper. So we've put enforcement into the executive order. So what that means is, and Mr. Governor has been very clear, that we should give Lagosians a grace period of about 6 to 9 months of massive public health awareness campaigns, just to tell Lagosians what is the significance of insurance, the concept of pooled funding and risk equalization and cross subsidies, so that the public are aware before we start to enforce. So what does enforcement mean? It means if you want to access certain government services, you must show evidence of an insurance that's compliant with the law. Just like you need to show your LASRA card or your NIN, we're now going to include evidence of the fact that you either have an Ilera Eco by itself, or you have a private health insurance that has now embedded the basic components of social health insurance in it. Most private health insurances have that anyway, but we just need to make sure that it's structured, and we're fusing the entire ecosystem of health insurance so that we're all operating really in a unified environment without all these silos and segmentation.
Right. So where can one gets the social health insurance? Because I know that there are multiple hospitals, across the HMOs, and when you want to do your that time when we want to register for the health insurance, there's so many, even the private hospitals, they will say you can choose any private hospital to register. I do know someone that said that even the Ilera Eco, maybe hospitals close to you can do it. So can you register with Ilera Eco in private hospitals as well, or is it just the public hospitals where they're
So at the moment you can register in both our government hospitals and PHCs, or you can register in certain private hospitals that have been accredited.
Okay, so that's where I'm going. Where can you find these accredited certain private hospitals? Because it's not everyone.
So when you apply online, or you can go to any of our kiosks,
so you have a list.
They'll ask you, where do you want your primary registered facility?
Right.
You may want to have it close to your home, or you may want to have it close to where you work. All right, but you have to register in a facility.
Right.
So when you're applying for social health insurance, Ilera Eco, it'll ask you where do you live, and then it'll give you the options of the facilities around your home for you and your family, or if you choose to be insured in the vicinity of your work, then you can choose that as well.
Okay. On that, we have heard, and I want to believe that you must have heard as well, the allegations in some quarters that the kind of services that people get from hospitals, from public or private, through health insurance is not as up to par or as commensurate as with what they would expect. Have you heard that?
Yes. So what we're doing now is we're transiting from the pattern of paying out of pocket to paying through pooled funding. So if you go to a medical facility in South Africa or in the Middle East or in Europe or in America, nobody expects you to pay cash. Everybody brings out some form of health insurance. It may be a basic package, or it may be very sophisticated. So what we find in Nigeria is that out of the 30 trillion naira spent on health in Nigeria annually, 30 trillion naira, almost 80% of that is spent out of pocket. And about maybe 2 or 3% is spent using insurance premiums. Now that is completely lopsided. So what we need to try and do is to shift people away from spending out of pocket, because what does spending out of pocket mean? It means you're faced with catastrophic health expenditure, because you never know when you're going to be sick. And all of a sudden you're sick, or a family member is sick, and the bill exceeds your financial capacity. So the contrary to that is, if you had an insurance in your pocket and you fell sick, you put your insurance card on the table. Now, at the moment, the healthcare providers prefer you to pay cash, because it's instantaneous and they can charge essentially a variety of services, you know. But that's an anomaly, really, in the health financing space. We really want people to enter a pool where the well look after the sick, the rich look after the poor, the elderly, the young look after the elderly. So everybody's in that pool. And as that pool gets bigger, there's more funding in it. And you're able to look after each other without even feeling it.
Okay.
So when you get to the hospital, or your family gets to a hospital, but you put a card on the table, and that becomes the norm, then the issue around stigmatization that you've correctly identified, because with insurance, it takes a bit of time for the money to come through, even though there's a component that's automatically remitted to the facility. But if you exceed that capitation amount, it's called fee for service. So you need to make an application to the insurance HMO to say, I'm in this hospital, I need X, Y, Z.
Yeah, I think some of us fall into that category, because there are some years I wonder. I keep picking up cards that we use here, you know, as part of our health insurance, and I never use it. I hardly ever use it, but of course it's been paid for. But the hospital visits are not that frequent, and I keep wondering, okay, where's the money? Is it just going to sit there? Who is it being used for? I don't use it because I don't go to the
Should Joke be penalized for that?
No, but I don't. No. If I don't have a hospital visit, but the money is being deducted as per insurance.
So what she's doing is she's donating her money to somebody else.
Yeah, that's. I think it's just a perfect example of what he described. I think we're looking after each other. I said so.
Okay, but you know, the question there is that of trust, because on the one hand, and there are very, very critical issues that you have raised, Prof. No, we can't all afford to pay for our health. That is the truth.
Yes.
Correct.
To get this thing now, in some quarters, you pay between 50,000 and maybe 150, in some cases 300,000. This guy earns 70,000 naira per month.
Exactly.
And he has to use glasses, otherwise he will not be able to perform the job well, you know, and all of that. But so let's talk about the issue of trust.
Yes.
Both of the people, trust by the people of that government initiative of health insurance, and then the trust of the health care service provider of getting their money in good time. They are a business. They have to survive so that the next patients can come in and still meet their organization, not just working, but also upgrading, because that's the nature of healthcare provision. You have to keep scaling up. So let's talk about the trust element. People don't generally trust government, whether they're in business or they're individuals. How are you bridging that gap? Maybe that's one of the reasons the governor said we should give this 9-month moratorium.
Okay, I think you've hit the nail on the head. The issue of trust, but it's not just about trust in government, but it's in trust in both the providers and trust in the insurers. So the first thing is, what quality of service are you going to get when you get to a public health facility or even a private health facility? And this is something that we're working on assiduously in government. We've really increased our budgetary expenditure around infrastructure. We're building brand new hospitals. We're building PHCs. We spent a lot of time redesigning our blueprint. It's called Mr. Governor's Blueprint for Healthcare Infrastructure. We've got international architects, local architects. We're using sustainable energy because the cost of running our facilities are prohibitive with the cost of fuel at the moment. So a lot of them have solar, ventilation, shading from the sun. We're looking at how patients move through the facility. So all these new designs are, first of all, to increase the efficiency of the facility, but to also improve the quality and experience of the patient when they come into our facilities. So that's one. The second thing is we have a major human resource for health deficit. And you've probably heard that we're working on establishing a standalone University of Medicine and Health Sciences to ramp up our intake from about 500 a year to 2,500 over the next few years, so that we become self-sufficient in terms of production of healthcare professionals. Now, around this trust issue, we have to regulate the services. So we have an agency called EFAMA. We've also privatized a component of EFAMA because there are 3,000 healthcare facilities in Lagos. And we have one agency that needs to monitor them, at least see them once a year, and at best, twice a year. So you can imagine one agency trying to visit all government health facilities and all 3,000 private healthcare facilities twice a year to ensure that we're meeting standards.
How many are they? I mean, how many are the pharma people?
So that's what I'm saying. We franchised.
Yeah.
So we invited the private sector, and we created 15 franchisees. And we've given them each a zone in Lagos to just make sure that we touch base at all our healthcare facilities. So we're trying to improve the quality of experience through infrastructure, through manpower, resourcing, through regulation. And you see, you can't sell insurance if the product is not good. The product here being the supply side, where the provider meets the need of the care of the patient. It's just like me giving you a credit card and I say, here is my gift, or a gift card. And I say, go to this supermarket and buy anything you want. And you walk in, first of all, they're rude to you at the entrance. You get in, there's no light. The place is dirty. You look at the shelves and it's bare, sparsely populated. Some of the produce is going bad. You're going to walk out of that place. That place being synonymous to a healthcare facility. You're going to walk out and give me my card back and say, I'm sorry, I'm not interested in this. I'm going to find my produce elsewhere. It's the same thing in health. The quality of service that we deliver to the patient must improve to increase the trust that when they get into a facility, they're going to get a standard of care. Not only that, the healthcare provider mustn't be outdone by the system. So he provides you care today and he's waiting 3, 4, 5 weeks for his fee for service to come in. And even when it comes in, it's substandard in terms of economic realities. So this is what the LPHP is all about. We're taking control of the insurance ecosystem. Government, for the first time in Lagos State, we're going to really have oversight over what's going on in the private healthcare sector and the public healthcare sector in terms of insurance. Make sure that the experience is right. Make sure the providers are getting their value fast and equitable and quickly. And we're protecting the insurance HMOs as well. And most important, the patients.
Prof, to anyone who cares to listen, I shout this one thing, the challenge of communication. Mm-hmm. I have been around for a bit, and I have heard and seen some healthcare providers, particularly at the local government areas, local government levels, the way they talk to people and all of that. Well, some will loosely call it customer service, but these are not just, this is a specialized field. So is there any health communication program, or do you think there is a need for it? It's probably a little bit on the upside to be expecting that government is going to do everything, because at the end of the day, it's the individual. But the wonderful initiatives that we are talking about cannot really be done by governments as some phantom entity. It's individuals, humans that are going to represent government. So how are we ensuring that we close all those communication gaps between the provider and the irate customer, the patient, and sometimes even communicating whatever it is that is their challenge to them? They're irate, they're unruly, they're impatient, and all those things. It's for real. It's something that has to happen. But because, I mean, they are irate, they have a loved one that is dying and all of that. So what are the challenges you have seen in your space as the Commissioner for Health in Lagos? And maybe you have some other examples from other parts of the country that you say we need to do better in this area.
So one of the fundamental issues here is the deficit of human resources for health. They say, my estimates are based on WHO standards. We have a shortage of about 30,000 doctors.
Wow.
And a shortage of an equal number of nurses and other healthcare professionals.
In Lagos or in the country?
In Lagos. In the country, it's even worse, because Lagos even drains, when we put out an advert, we drain other doctors and professionals from other states to Lagos, and then from Lagos they drain out of the country. You know, so it's not so bad in Lagos, but it's still bad, you know. And we've looked at this issue, and that's why I'm saying we're looking at the production. So we want to, first of all, stop brain drain. We want to increase production, and we want to activate brain gain. So all our diasporian doctors that are around the world, there's no Nigerian really that wants to be away from home, you know, mostly. They all, on Sunday, I've been a diasporian myself, we all meet, we sit down, we eat jollof rice, eba, and pounded yam or whatever. And the common narrative is, what's going on back home? I wish I was back home. So for us in Lagos, we're trying very hard to neutralize brain drain, reverse it with brain gain. And how do you do that? The best way to do that is to restore healthcare into the mainstream economy. All right. At the moment, it's operating a little bit on the periphery because the doctors are not getting their value. They're not getting their worth. Now, the WHO says there should be one doctor for 600 population. In Lagos, we have one doctor for 5,000.
Wow.
So you can imagine that doctor or that healthcare professional is doing 10 times the work he should be doing. So understandably, everybody is a little bit on the tense side. And as much as it's an empathetic profession, you know, we're still human beings, but we don't give that as an excuse. Government is working very hard on training around empathy, on training around relationships with patients, with family members. We understand that everybody is working more than they should be working, but it's a profession that we've chosen. It's a vocation. You know, what comes first is your love for the patient, your love for the service, love for humanity. And so while we understand the stresses and strains on our professionals, we don't condone, sharp practices and rudeness or lack of empathy. Especially, you know, when you're sick, the doctor is almost the next person to God, you know. And, you know, you have to beam back that essence of hope, because it's the hope that helps the patient to get better.
Right. So tell us more about, you know, some of the what you do to make provision of healthcare services better and not just more affordable, but easier to get. Sometimes when you go to banks, you see a long line of people trying to access banking services, which is why you have the online platforms that you can easily do anything now. How are you simplifying healthcare services in Lagos? I know there's some Lagos Smart Health Information platform, that digitalizes healthcare. In Lagos. Tell us more about that.
So we've been working on the SHIP even before COVID. In fact, it was my first project before COVID hit in 2019. And SHIP stands for the Lagos Smart Health Information Platform. In its first phase is to digitize the entire public health service. So we're installing infrastructure. We've launched it at the moment. We're almost 30% through the public side. We're installing infrastructure in all our general hospitals, our PHCs, our tertiary facilities. And in the next 6 months, we're going to complete that phase. The information will now come in. Every aspect of health-seeking behavior will be captured digitally. It's going to do a lot of things. It's going to speed up efficiency. It's going to block leakages. It's going to improve the manner in which we deliver care, because with the age of AI and machine learning, there are several physician assistants now that are technologically driven. And very importantly, we might be able to manage people more effectively outside of the hospital through telemedicine and virtual clinics and robotic distance amenities. We did that in COVID. At the beginning of COVID, the law from the federal government was everybody that tested positive by law needed to be isolated. That's why people were running and hiding, were smoking people out of their residences, But then we were diagnosing 20 a day, 50 a day, 70 a day. But as COVID took control of Lagos, we started diagnosing 500, 1,000 every day. Where do you put 500 people every day? We had built almost 20 isolation centers all over Lagos. It meant you need to build one isolation every day to accommodate everybody that was positive. So we said, okay, this is not going to work. We can't carry on like this. So we had a dialogue with federal and said, we have to change the policy. And they said, what do you want to do? I said, we're diagnosing so many people, and we know that not everybody with COVID is that sick. So we could divide everybody with COVID into 3 types. Those that were really, really sick and needed oxygen and intensive care. Those who were reasonably unwell, had to lie down, can't do much. And those that were very mildly affected by COVID, and some of them didn't even know they had COVID. So why would you isolate that category with everybody else that's literally moribund or, trying to kick the bucket, So it was very important that we separated patients and we managed those in the sort of mild phase at home. And we set up a very effective telemedicine management of COVID. So these are all the things that digitalization can help us with. We're very, very serious. It's moving very quickly. We hope that once we finish the public sector, that we can introduce it into the private sector, because it has a lot of efficiencies and gains that will benefit in both the private sector.
And I know you have a question, but one quick one. The first thing maybe you'll tell us that before we close. I was going to ask you before the magnitude, but if you can say it in like a minute or so. I saw you age very quickly during the COVID era, and I know this man must not be sleeping. How did that first hit you? I don't want you to spend too much time on it. It's a personal thing. How were you able to live through that period, that COVID period, where it just exploded in our faces like this thing is real, and how are we going to cope with this pandemic?
Do you want the truth?
Yes.
I don't remember. I don't remember most of COVID.
Okay, fine.
I have to go to the videos and watch them.
Because it was an emergency.
Yes, because all your briefings and all that, you know,
I was on adrenaline and steroids.
I can imagine.
Everyone around me, the entire, even the governor. I mean, we didn't sleep.
Yeah.
We had war cabinet at midnight every night. At 1 o'clock, we finish. We changed the policy for the next day. Everybody was getting like 3-4 hours of sleep a day.
Wow. If at all.
I went gray during COVID.
I saw you age practically. I saw you because I saw. But one thing, sorry, I'm so sorry. Before we are running out of time, but there's this huge structure when you're driving off the 3rd Mainland Bridge. You want to go into Ikoyi, and it's there, the new Massey Children's Hospital. When is that going to be finished?
Well, so that's one of Mr. Governor's blueprints.
Yeah.
There's Massey, there's Ojo, there's Ketu Ejiri Mental Health Institute, there's Shomolu. We're doing the Cancer Center in Ikeja. We're doing the Medipark on Awolowo. We're building new PHCs all over the place. But that one is iconic, and where it sits, you can't miss it. It's just glaring at you. You can see that it's completed. It's 10 floors. We're just, doing the mechanical, electrical, and plumbing at the moment. They're plastering the building. We're looking at how to operationalize it. Hopefully in another 6 to 9 months, it will be complete. And then before the end of 2026, we're hoping to commission it as the largest pediatric specialist referral hospital in Nigeria, if not West Africa.
What will happen to the previous one? It will still function?
No, we'll refurbish it.
Right.
Because the need for maternal and infant care is huge. So once we operationalize the new specialist referral hospital, we go back and refurbish the old Massey, because a referral hospital, you can walk into it, but really what is it designed for? It's like Great Ormond Street in England and Red Cross Memorial in South Africa. You're supposed to send really complicated cases from all your facilities, both in Lagos and Nigeria.
Okay.
Children that need heart surgery, children that need brain surgery, people that they need a transplant of some sort. It's supposed to be the highest level of expertise.
So are you going to recall all your brain-drained doctors to come back?
That's part of the health financing plan. Prof, I have to ask you this. Research. And Lagos probably kind of prepared for COVID with Ebola.
Yes.
But we can't say that we were sufficiently prepared, particularly in the area of the disposables that you have to give to the people that have to work and all. In the wake of COVID, one of the issues we raised with the NAFDAC DG was, what are the low-hanging fruits we had, to fight these whole things? And she talked about phytomedicine as a low-hanging fruit that we had as a nation. Now, but over time, every time I had opportunity to ask her, I asked that question. And one thing that's been consistent is the gap between the proof of phytomedicine in Nigeria and the actual, results that it's going to prove, So, and that gap can only be filled by research. Yeah. Now, she also told us that we were health insecure because some of the substantive components, I don't know what you call them, that we needed to use were being imported into Nigeria. And if there was a drought anywhere else, we were vulnerable in the country. Raising the question of research, is there a plan in this whole melee that the Lagos State government has to have a system where, okay, Lagos is producing its own health products, no matter how complex, using maybe phytomedicine or what? Just help us understand if there is any space for filling the research gap that can help with the healthcare provision in Lagos.
Yeah. So this is one of Mr. Governor's biggest priorities and project. It actually even has a name. It's called LASMIZO, Lagos State's Medical Industry and Innovation Zone. And what we're doing is that there are two parts to this. So it's called research and development, R&D. Research without development is, it just doesn't.
Academic.
Yeah, it's academic. So we have all these academics in Nigeria. And in Lagos, we have a huge plethora of them. We use them effectively during COVID, and we defined our own COVID narrative in terms of how does COVID affect Lagosians. So what we need to do is harness these researchers and create the environment where their research actually translates into solutions for indigenous problems. So first we want to focus our researchers on local problems, not esoteric things that maybe are useful in Australia or wherever. What are the problems in Lagos, Nigeria? Let our researchers focus on that. We've set up a grants management office in the Ministry of Health. We've set up the first intellectual property desk. Critical if you want to do research. When you find something, you must go to lawyers that understand intellectual property. And we didn't have much of that. So we've set that up in the ministry. So the researchers, the moment you publish your data, you've lost your right to it. So if you've discovered something, you need to go to an intellectual property office and let the office guide you in how you use that potential discovery that could have a potential solution, indigenous solution to a medication, to a vaccine, to a consumable, to a way in which we treat local problems. So the whole idea about LASG, and we're moving it to the free trade zone in Lekki. We've been allocated space there. We're going to be attracting international manufacturers, international innovation centers to work with our local researchers. Now, what are the ingredients here? The ingredients here is the ship, the digital platform, because you can't do research without data. Mm-hmm. So if we're collecting data on all the health-seeking behavior of Lagosians, you're already sitting on a gold mine. Mm. Of course, we need to protect it. The second thing is you need a biobank. And Lagos State built the first biobank in this country, I believe. It's in Yaba. We used it during COVID. There's another one that has just emerged in Nigerian Institute of Medical Research. So we now have 2 biobanks in Lagos. So when you combine the biobanks with the data repositories, and you stimulate the research, and you bring in international partners, right, to help us add value to our discoveries in Nigeria without shipping out our samples and shipping out our data.
It's actually been very, very concerning, Prof. Mm-hmm. Can we start with malaria and not be using, what's that called? Artemisinin?
Artemisinin.
Yeah. Can we start with this research? Can you propose, okay, within the next 1 year, 2 years, all solutions, health solutions for malaria will be home built within the next 1-2 years? Is that possible? I'm trying to jumpstart the process.
It's very possible, except you've chosen the wrong disease, because we're about to eliminate malaria in Lagos.
Mm-hmm. Oh, okay.
So we can move that conversation to Ogun State or Oyo State. but malaria is now a rare disease in Lagos.
Wow.
Out of 100 fevers, and this research is very robust and very, very important that your listeners hear this. Out of every 100 fevers in Lagos, about 3 or 4 is caused by malaria. And we've repeated this with some of the top scientists and the most robust laboratory investigation. So malaria is a rare disease in Lagos right now.
Your people came the other day. We had a conversation
So
with them.
if they tell you have malaria, question it.
Question it.
Ask them to show you the results, the cartridge. It's there. Your eyes can read it. It's yes or no, And let's stop fooling our citizens. But although part of the problem is Lagosians want to be diagnosed with malaria because they want injection or they want IV fluid. But sometimes all you have is a viral illness that mimics malaria, which is what is happening in Lagos. This so-called malaria typhoid diagnosis is an unknown.
It's the double jeopardy diagnosis.
It's a sledgehammer. You get an anti-malaria and a myriad of antibiotics and painkillers. You know, and really what you needed was go home and rest and isolate yourself.
Okay, tell it to the boss in the office. Well, clearly, Prof, it's always what we call an interviewer's delight. Speaking with you, you almost don't even want the conversation to end. But unfortunately, all good things have to come to an end at some point. Thank you so much for your time.
It's been a pleasure. Thank you for having me.
We hope to have you a little more frequently because,
Well, just invite me out.
No, we need to pull down that metal door in front of your office so that we can have easier access. Professor Akin Abayomi, Commissioner for Health in Lagos State, we appreciate your time today.
Thank you very much. It's been a pleasure being here.
Okay, now you have heard. Malaria is now a rare disease in Lagos. Okay, so those people that have been telling us that we all have malaria, whatever, in our bloodstream.
It's endemic.
Anyway, that's not the next conversation. We'll take a short break and we'll be right back for the next one. All right, thank you so much for staying with us this morning. There are some things, when you hear certain words, MPC, MPR, the next thing someone is going to ask, how does that change the price of bread? And that's where we're going this morning. You've been hearing all the technicalities, all the big issues about the cash reserve ratio, the monetary policy rate, inflation number, CPI, consumer protection, consumer index, all those things. Let's bring it home. And then another part of this whole MPR issue that we don't hear much is we seem to be cutting the states some slack. While it's easier for us to understand that MPR issues are federal decisions, macroeconomic issues are federal, conversations. How about the states? Don't they have anything to do with in all of these conversations that we're having? Well, that's why we have Dr. Ayo Teriba with us in the studio this morning. Thank you so much for joining us, sir.
Thank you very much. Good morning.
You've been at this for a while, and so people need to understand that. By the way, Dr. Ayo Teriba is CEO, Economic Associates. I've listened to you, I've heard, and read up some of the things that you have said. And one of the things that we like to achieve with Sunrise on Saturday morning is a kind of digest. You remember Reader's Digest, right? We just want to bring it down, right? To drive it home to people so people understand exactly what the issues are. So it goes, first of all, to the impact on people. First of all, give us an understanding of what is out there, what is playing on, what the the CBN is playing on through the MPC to maintain the MPR the way it is. What is the government playing on for retaining it the way it is? And what are the likely implications on people?
All right. Well, thank you very much. It's my pleasure to be here, and the role we play is to break things down for all to understand. Let me correct the impression that the central bank or the Monetary Policy Committee left the monetary policy rate, which you call the MPR, the way it is. That impression is not correct. And so they left it at 27 at this meeting. At the last meeting, they reduced it by 50 basis points from 27.50 to 27. Ostensibly because there was a corridor of plus 500 above the MPR before the last meeting. First, the corridor was minus 100 to plus 500. They shrank it so from a band of 600 basis points to a band of 500 basis points. And dragged it down to a symmetric corridor, 250 below, 250 above. So the reduction from 500 above to 250 above was actually an easing of the policy rate. So they did 50 basis points on the rate and 250 basis points on the corridor at the last meeting. So that was easing by 300 basis points. So they came to this meeting, didn't touch the rate, but further dragged down the corridor to plus 50. So you've been, since last year, we've been at plus 500. So today, it's at plus 50. So, and that plus 50 was the 50 they took away. So they've actually eased the monetary policy rate by 500 basis points in 2 meetings. That's a lot of easing in 2 meetings. Are we together? Yeah. So let's not, I mean, I wonder why the central bank or the MPC chooses to operate in the corridor rather than the rate. But the point is, no bank can get access to central bank credit. You know, at 27 today, it will be at 27 plus the 50 basis points that is in the corridor. And previously, it would have been at 27.5 plus 500, which is at 32.5%. That's what carried from a year ago to when they eased for the first time in September, and they eased again that corridor. So banks can breathe more freely now. It's not 32.5. It's now 27.5. And that's a lot of easing in 4 months. Does that...
Well, it's a start. What does that, how does that, as we said at the beginning, how does that affect the price of bread? Because...
it's a two-edged sword. It's a two-edged sword. Yeah, if you ask everybody who sits on the Monetary Policy Committee, they would love to set the policy rate as 2% for the benefit of Nigerians, so credit is easy for everybody. And but why did they hike it in the first place? You will recall that when this regime came, both the government led by the President, His Excellency, Asiwaju Ahmed Tinubu, and then the central bank governor that came a few months after, and then the Monetary Policy Committee that came, you know, in February 2024. We had massive issues of unstable foreign exchange market with large premium between the NIFEM and the BDC, which had precipitated an accelerating inflation. So the reason they hike was to support, you know, the interventions in the foreign exchange. When the market was liberalized, they needed to tighten to ensure that the market, foreign exchange market, returned to stability. And everyday Nigerians, you know, felt the pinch of an unstable exchange rate, depreciating currency from June 2024 to November last year, to a year ago. The exchange rate stabilized a year ago. The two rates became convergent increasingly. And we've seen appreciation between November last year, we saw the worst with the exchange rate. Between November last year and today, we've seen nothing but stability and appreciation. That's why they tightened. So let's count that those gains. I mean, the currency peaked at 1,750 in November 2024. Today is 1,450. That's 300 naira gain per dollar.
Right.
For anyone that holds the naira, anyone who lives in Nigeria. Another benefit of that is that as the currency was in and got to 1,750, inflation accelerated every month for 18 months until the same November last year, when it peaked at 34.6%. But since the exchange rate had stabilized and had been appreciating in the last 1 year, inflation itself, starting from December, it dropped to 33. January drops every month except March. Inflation had been decelerating. That's benefit for Nigerians. That the tight monetary policy regime had end for them. And so you are looking for the central bank to be careful not to throw away those two benefits of a stable and appreciating exchange rate and a decelerating inflation. The third benefit that the tight rate is that with stable exchange rate, with decelerating inflation, we've seen growth acceleration. It's benefit for all Nigerians.
But it hasn't still affected the price of bread. Food cost is still there.
No. Market surveys show that food prices had been coming down. Why wouldn't they come down?
But not significantly, Dr. Teriba. Not significantly because...
Hang on.
Okay.
Inflation accelerated monthly for 18 months from June, every month from June 2003 to November 2018 months. So we've seen deceleration only 10 months or only 11 months, December last year and January to October, except March. So we've seen 10 months, if you like.
Are we in a hurry?
You are not going to.
Do you think we're in a hurry?
To do what?
To have ease of resources, lower food prices and all of that? And lower energy costs and all?
It's not within your control. We should be grateful, for small mercies, that whereas this time last year, things had been getting worse on a monthly basis for 18 months. Today, things have been getting better on a monthly basis for 10 months.
I know that, Joker would want to ask you a question
for 10
as well.
months, yes.
But, the challenge that I
thought it was important that we have a clear sense of direction.
I understand that.
So the tight monetary policy has and benefits.
I hear you. I hear you. I still have other questions for Joker.
I was going to go around that, when you were quoting all the figures and how beneficial it was, but we're
not feeling
it. We want to. I don't know. The market surveys, yes, it could say that things are coming down, but Nigerians are still complaining. Is it that it's a constant for Nigerians to complain regardless of the situation, or is it that they're really not seeing things the way they should? Or is it that Nigerians just are not patient enough to allow these prices crash? Or, last one, the people, the sellers, the people at the markets who are selling, are not being truthful that these things are cheaper and they're still selling to Nigerians at a higher cost than necessary?
See, the issues are so clear that you can't blame market women. You know what the Naira exchange rate is. At the NIFEM and at the BDC, they've converged now. We knew that it peaked at 1.9 last year. And now it's less than 1.5. So the prices that retailers will set at 1.9, it's called exchange rate pass-through, will be higher than the prices they are setting now at 1.5. It's evident. Somebody called me from one of the media houses and said that the urban inflation had been dropping faster than the rural one. Yeah, because appreciation of exchange rate gets passed through more or less instantaneously in urban centers. Now, point about Nigerians complaining is a matter of education. They might not have sat back to know that, okay, higher MPR had supported a regime in which the Naira has been strengthening and inflation has been coming down. And that they shouldn't ease it too fast. They've done 500 basis points in 2 meetings. They shouldn't do it too fast so as to throw away that gain. So it took 18 months, consecutive months of depreciation of the currency, volatility, and acceleration of inflation to get Nigerians to troop to the streets in August last year. Hunger, now it's taking 11 months now of ease. Let's be patient. Let's see how we get to 18 minus 11. The next 7 months we probably will be at 6% inflation. It's now at 16, dropped from 34.6, which is 35, to 16. So if you do 5 more months in that trend, you will be in single digit. You could be at 5%,
right?
Which will be easier life. If the naira keeps strengthening, the more it strengthens, each Nigerian gets better off by the day, by the month. And if the growth acceleration gets more entrenched, that's increased income, increased prosperity for everybody.
Right, okay. Right.
Yeah, it took a decade to get 139 million Nigerians into poverty. So a recovery, so we are now in a recovery phase in 2025. And let that recovery also become sufficiently entrenched that you see that people get, will get lifted out of poverty.
Dr. Teriba, if I ask you this, there always seems to be like a surprise when the CBN comes out with its decision, the MPC comes out with its decision, and economists and analysts would say, oh, we're expecting it this way, or we're expecting it the other way.
Yeah.
We expected them to maintain if they change, or we expected them to change if they maintain. I know that the CBN governor and his team and the central bankers and all that, they were all economists at some point before they got appointed to their various. They were in the system. So why are the expectations different from sometimes what the MPC does? I mean, is it that they don't think that this is the way to go? Or is it that the economists know better than the MPC? Because I'm always very confused when analysts say, oh, why did the CBN do this? They should have done that instead.
Oh, well, it's in the context of communication. The central bank and the people on the Monetary Policy Committee are privy to information that we are not privy to. And they will take the decisions that are in the best interest of everyone. So if they feel that holding on to the tight regime for a little more while will allow the benefits of a stable and strengthening currency to become entrenched, will allow the benefits of a decelerating inflation to become more entrenched, they will hold. Whereas the market may be in a hurry to see an easy regime. And now, for all that they have done in the last 2 meetings, easing the corridor from plus 500 to plus 50. People are not acknowledging it. Several people have called me to say they held at 27. But I said, but they eased the corridor. But they eased, you didn't notice that the corridor is around the monetary policy rate. Are we together?
Yeah.
Yeah, so they are now easing. And let's hope. They eased slightly in the corridor in the last meeting. They've eased further this meeting. Let's hope that the benefit of a strengthening naira and the decelerating inflation is not derailed even by that the easing. Because if it is derailed, then they will tighten the ones again.
Can we, is there a possibility, Dr. Teriba, of a fast-tracked process? Here is what I mean. To a large extent, as I said earlier, when we talk about all of these issues, the states are not even in the mix at all. Is it to say that, okay, maybe I should ask it straight up. Are there practical steps that you think state governments can take to reduce the pressure that this MPR is having on local businesses and even on the residents in their states?
Okay, yes. I mean, we can address that question. It's very important. And it's a major pillar of what the current government is doing. The renewed hope policy. And I've seen many states announce the introduction of urban transit. Kaduna, 100 CNG buses. Enugu, 200 CNG buses. Plus, is it 1,000 or 2,000 taxis, new terminals? So Lagos had done 2,000 taxis, lag ride. Now they've done an additional 5,000. They are doing rail, BRT started from here. You now have, you have rail, you have buses, you have taxis. From Kaduna to Enugu to Lagos, many states are actually, intervening to make transportation, energy transition easier for their populace. All of these initiatives, 100 buses, thousands of taxis, create employment, create income. The rail service in Lagos employ people. People generate income to complement, what's happening at the, national level, where, central bank is using its monetary policy decisions to make sure that the naira is stable and is better for Nigerians purchasing power. Inflation is coming down. So that we are making interventions that are generating employment. Look at the terminals that were launched in Enugu. Or you look at what they are doing in Akwa Ibom. They are, the airport just got, elevated to status of an international airport. The traffic that they generate to the stadium in Uyo for FIFA-rated matches, so you now can connect directly. They have also an airline that helps that process. In Imo, you've seen the Skill Up Imo policy that Governor Hope Uzodinma has been championing.
So shouldn't all
training, more than 50,000 Imolites now.
So shouldn't all these
adjusting wage, pay rates.
Shouldn't all these things that you mentioned have a direct impact on reducing? You said something about the urban Nigeria feeling the benefits of the MPR quicker than the
rural.
So if the states are as active as they should be, shouldn't the rural areas also be feeling it as quickly?
Well, you don't have as many brody change in the rural areas as you have in urban places. So the benefit of a strengthening naira will be felt first in urban places. There's very little you can do about that. Market information are likely to be transmitted more quickly in urban places.
Well, Dr. Teriba, many times when we talk about all these macroeconomic issues, the only thing people want to hear is, the only thing most people want to hear is, when is food price going to come down? When is energy cost?
It's been coming down.
It's not coming down quickly enough.
The point is that if the gains of 2025 are sustained, the pains, we are moving further and further away from the pains of 2023, 2024. We are now talking about gains in 2025. If we could make sure that these gains are what characterizes 2026, by this time next year, we are talking about the exchange rate improving from 1,750 in November last year to 1,450 today. If we are speaking about a similar gain next year, maybe we are talking of 1,150. I tell you, the inflation rate that has dropped from 34.6 in November last year to 16.0 in October will probably be 5.0 this time next year. And that will be approaching El Dorado.
Well,
so slowly but surely.
Well, we can do, the most we can say is just to continue to hope, because at the end of the day, there's only one opportunity we have, and we have to make the best of it at all times. The next time we have you here, we hope it to be down to 6%, just as you have said.
I hope so myself. So government can borrow a single digit.
Right.
Thank you so much for your time this morning.
Thank you very much.
CEO, Economic Associates. We appreciate your time today.
Thank you.
Yeah. Now, one of the things that's made all these, a thing is, when some things continue for so long, it becomes some kind of culture that you find it difficult to even imagine a life different from that culture. But we're not talking about insecurity, we're not talking about finance, health finance, we're not talking about the economy. What we're talking about is life.
Your business will bring you gain. If you believe it, say amen. 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 Amen.
Welcome back to Sunrise. And now we're talking about what he talked about before we went on break. When something shocks you.
When culture fights back. Come on. It's on your script.
No, it's shocking. When he fights back, is it not a shock? So we have when culture fights back, and what do we mean about that? You're about to find that out in a bit on the program. Patriarchal privileges are the social and institutional advantages men historically have had in patriarchal societies. Why is that word so difficult?
Well, because it is a difficult word. It's even a difficult conversation to have in the first place.
Leading to greater power, control, and status in areas like politics, economics, and family life. Examples include greater access to positions of leadership, the accumulation of wealth, and the ability to exert control over women's bodies and reproductive rights. However, these privileges often come with a cost for men who are also harmed by patriarchal norms that pressure them to be stoic, suppress emotions, and take on more risky behaviors. Men don't cry is what they say. I don't believe that. So I guess today...
Even if men don't cry, men should cry.
Men should cry.
So let's have, because people even need to understand that why it's a trap.
Yeah, it's a social and emotional trap.
Why it is a trap, why men don't cry, why it seems like the society is always depending on people and all of those things. We'll find out more on that. Who is our guest, by the way?
Our guest is a certified family systems engineer and family coach, love and life experience architect, and a whole gamut of things that we can't just start explaining. Digi Showme. He joins us in-house. Thank you so much for coming back to talk about all these things.
So, first of all, let's help us understand this. First of all, when the term "when culture bites back" comes out, what does it sound like to you?
First of all, I'll have to look at what culture is before we get to why it's biting back. Culture is the behavior of a people over a period of time. Culture is simpler than people think. So because it's over a period of time, it has the ability to be progressive, or if you allow it, to stagnate and eventually become regressive. But because it's over a period of time, that means that at every period that we think there is an advancement, we need to sit together, look at the culture. Is it helping us or is it harming us? Which will now lead to the formation of cultures that will support us better per time, rather than sticking to what we have over a long period of time. Now, when we now say it's biting back, this is that we are at a point whereby it is harming us, but because it's giving privilege to probably a particular demographic, we are not trying at all to review it. We are just going to stay married to it. But it is because we're not thinking about it to a deep extent. That is why it has the ability to bite back. So when they say culture is biting back, it just means that we are not checking ourselves and we are probably not progressive. That's what it speaks to me.
Okay. Is that to say that the first culture that is biting back crept up on us, or we practically lived ourselves into it?
It did not creep up on us. We just did not bother to check it. It was handed to our father, grandfather, great-grandfather, and so on and so forth, who continue to hand it downwards to their own children till we have it today. So today, we are at this level of intelligence, of progress, of development, but we are still administering a culture this low that is harming the progress that we've made. Let's take the holy books, for example. Both the Bible and the Quran are recordings of culture that have happened between 2000 to 1,600 years ago. If you want to apply what's in there word for word today, not the religious or faith tenets, because it's also a recording of the culture of those people in the Middle East. If you want to attach that today, then you and I should not be wearing these pants and shirts. We should all be in gowns. We should all have hooded gowns, because the dresses were for sandstorms when they came, and the men wore gowns because they were shepherds, they did manual labor. The linens kept them cool in that heat. And when a sandstorm broke, they didn't have technology then, they just call up under a tent or wherever they can find themselves to where it is. That is the reality of how it's happening in our present life today.
Okay, so how do you think, how do some cultural, expectations that seem like privileges, how do they end up limiting men emotionally, mentally?
Okay. Today, when you look at it, men fill up the boardrooms, they fill up the law, they fill up even the family meetings. They just seem to have a space reserved for them. It has nothing to do with merit. That lady over there is more brilliant and stuff, but no. People respect a man, so put a man in there, a figure that we can respect. And it starts very, very early. Let's take a little boy, for example. That's how early it starts. It has to be strong. Strength is a particular value we worship in our culture. Strength is very, very important to the human in these parts of the world. Okay. So, he must not cry. He just hit his leg on the concrete, on the pavement where he was playing football, but he must not cry. So like that, we've done a surgery to cut his heart from his mouth. He cannot voice the words, "I am hurt." We take away emotion from him. Then this boy grows up. That 25 years, he's married. He's dealing with a lot of pressures, financial, emotional, social pressure, a lot of pressures in his life. He's married. Then he's internalizing everything. He can't complain. Then he hits the wall. Or worst case scenario, he hits his wife. We have nursed him to have only one emotion, which is rage, anger. It's like a pressure cooker. When that thing starts to, the pressure needs to be let out. If you don't let it out, it explodes. That is the only emotion we live with him. So the family that he has said he wants to protect, he wants to guide, he wants to provide for, he ends up violating this family through his anger. That works against him because they will avoid him, they will loathe him, they will resent him. With force must come resistance. That's one of the ways, that's an example of how it works out.
So does that make the man vulnerable? I ask that in the light of, the impact of his person and this dominance on his family. You won't be able to have genuine connections, really.
Of course, he has no connections with his family.
Oh, wow.
He can't. Okay. That leads me to another example. Is the sole provider, is the breadwinner. Now, to be the sole provider, to be the breadwinner, all you've been told is that you are the head and you have to provide. All his value is attached to what? Provision and being the head. That means that if his wife is successful, his wife becomes what? A rival to his position as the head.
And then resentment.
And resentment sets in. So he goes about it the only way he knows. Incapacitate her. Let her do small business or let her do nothing so that she can rely on me. Then he goes out there, he bears all that weight, that financial weight, because even homes of two parents today taking care of children, they can't afford their life. But he takes that on. At times he has to steal. At times he has to kill. That is himself. His blood pressure increases, all that goes all right. Then something that happens to him. He gets ill or he loses his job. First of all, that family is crippled because the wife is not equipped enough to carry that responsibility. You chose a partner, then you incapacitated them. The children are able to live the kind of life they want to live because the person that was affording it died or lost their job. They still end up resenting him because he was not available. There was no presence. He was always away. When he is having his pain, because it is pain, there's nobody to hug or console him because he never put himself in that position. That is a weakness. He can't say, I need help. He can't say, let us. He can't do that. It's only a woman you support that can carry the weight with you. But because of control, he did that. He kills himself. High blood pressure, stealing, jail, a lot of things can happen to him. He's killed himself.
I'm a little... So the culture is what we have had.
Yeah.
How is the culture now biting back?
Those are the ways in which it bites back.
It's attacking
the very people that it was supposed to give advantage to.
Okay, now, how do we reverse that trend? Because the reality, I'm sure you can validate it, this particularly in urban Nigeria, in urban communities all over the world, that those days of one breadwinner, those days are over.
Yeah.
And so it is now breadwinner and butter winner. Someone brings the bread, someone brings the butter, or something like
put
that.
It together.
Now, so there is always that now.
In addition to that,
That's a fantastic analogy.
Yes. In addition to that, in reversing that, nowadays we see people, referring to children, maybe you're the first son of a family, but you're just a little boy of maybe 5 or 6, and they refer to they start to refer to him as Oloriebi already. So the weight he's already.
He has no skills on leadership.
It's just innocent.
It's just
referring to him,
and he has to be.
And they're telling him he's Oloriebi, and then
it's not enough to say Oloriebi. You didn't finish it. Baba Bukata. In other words, he's the one that carries the weight of the world.
Yeah, he's already inferring it. So he grows up with that in his mind. I just want you to add that to whatever you're going to ask.
From that particular standpoint, like you said, it shows up a lot in marriage, whereby he is married to a fantastic and well-groomed woman who probably has achieved more than him. But because he doesn't see her as a partner, he can't handle her. That's why today a lot of women who prefer to leave their marriages and achieve a life for themselves than staying there and be narrowed. So he carries all this weight. Because he has told he has to be strong and silent, he can't even speak out to his wife. I know some men that because business was bad and they didn't make money this month, they removed themselves from intimacy and sex. That they don't deserve it. In fact, at times you hear some women mirror this particular line of thought. Do you think you're a man? You don't make money and you want to make love to your wife? You don't deserve that. And some men believe they don't deserve that because all their values is attached to provision of money.
Can we squeeze that woman's neck? Just so that she can understand how painful that is.
Yeah.
No, but he first started saying that some men also ascribe that to themselves.
And the thing is that the women didn't start saying it. They learnt it from what the culture has been saying. That is when the culture bites back.
Yeah.
They would believe it too. Some people are trying to explain themselves, and the woman ups and goes. Why is he behaving like a woman? Why is he talking so much? He's not talking so much, he's expressing himself.
Yeah.
But you started it first by having a superiority complex and making women seem inferior and turning the word woman into an insult. Why are you behaving like a woman? Which normally translates to, why are you being weak? Why are you talking too much? Why are you emotional?
Okay, so how then do you think families and communities can help men build back that connection?
It's a change of culture. We are never married to culture, we just don't know. Culture is the behavior of a people per time. This is a time. Studies about premarital, studies about family living, studies about family management, studies about partner or spousal management and partnership will help a lot to do that. And the problem of culture is that it is patterns that have been set over a period of time, over generations. So the sons have learned this pattern and will leave it out and transfer it to their own children too. The daughters have seen this pattern, are familiar with it. So when it happens to them in the future, they are not going to resist it. That's what happened to my mother. So we have to take a stand today and introduce family studies into our curriculums in school, because the home alone is not able to correct it. A man who is 50 years old today, who has grown up in this culture, will take a long time to have a system resettled in a way that works. And the painful part is that the family is the foundation of society, nations, and the whole world. Once it is affected, your society, your nation, your world is affected. That is the painful part there.
But then, you've talked about an old generation that grew up with this culture.
Yeah.
Right now, we have another generation of men and women who have recognized that one purse cannot feed the family sufficiently anymore. That recognition cannot be denied. Now, we are also building into a future where women are now the breadwinners. It is a reality in some environments, you know. And whether we like it or not, those cultural barriers are broken down, at least in urban centers all over the world, except in rural, particularly in Africa, where those things might still be strong. So what are your thoughts on that?
Okay, I am not speaking. When I'm speaking, I stay in Nigeria, in Africa. I stay in Lagos State. I grew up in Abeokuta and in Kaduna. I'm not speaking about Europe. Their system was always different, and they grew out of the patriarchal systems earlier than we have, and they still complain about the patriarchal movement, even abroad. Here, we are walking opposites. We have the education, we have the know-how, we've all had trainings at work, we have the knowledge, we know what is possible, but we will do it no, because we now feel that this advantage is too good to lose. But is the advantage helping you at the end of the day? What we are having today, if you don't realize it, is tyrants who are head of empty castles. Because the children are going to bond with the mother who played with them, who studied with them, who were around them. Not with you. That's why our men will grow up lonely. And it is a double tragedy, because there will still be no one to now rest on. In the time you need companionship, you need company. It is a terrible tragedy. It's a catch-22. Because we will continue to say this is the right thing, and we still will not do it.
Okay.
We still won't.
I thought Joke had a list of questions.
She probably does. She's a woman in this particular system.
Yeah,
No,
but it does affect the woman.
It does. It does affect the woman because apart from changing tables, which I've in a lot of circles I've been in, people have had that discussion that the tables are turning, and I think it's because at this point in time, I think even men are starting to realize that they can't do everything by themselves. That they've probably been lied to from the beginning that you should take responsibility for everything. You should. Even when you're getting married, you say, be aware, carry your wife, do all those things and all that. And they load that responsibility on the man. But I think at the end of the day, you sit down with your wife and say, okay, discuss finances. Even, when you're going for all those counseling in church, they tell you, discuss finance. They say, discuss your finances, discuss, there's no what's on board, what's going on, what each person can do, how do you contribute to the family? Because I think people are starting to realize that the burden should not be placed on the men alone, and things are changing. You talked about the future. So what do you foresee in about 10, 15, 20 years from now? How do you see this?
Before I go into that, there are two important things that you just said.
Yeah.
You talked about going home and sitting down with your wives. And that is the first thing I'm going to tell you. Marriage is a partnership where two people, male and female, come together, because male and female is completeness, and raise a family. You have to be responsible to know how many children you can raise before you start to raise them. Everything in the home is like an office. These are the things we need to do. How do we do them? It requires a system of transparency and of trust. Now, secondly, you said when they go to church for marital counseling, the thing is, we have ascribed marital counseling to the church. It is not only the church. What they do there is support. You should seek professional marital counseling. A lot of people do that. Now, we are still in a world whereby we believe that seeking help is a weakness.
Yeah.
You need to overcome that mindset, or else in 10, 15 years, what we have now is what we will still have. Some men, I'm proud of those men, seek intentional education and actually believe that their spouse is an equal, because they know that the best kind of life is not one that is controlled or you own someone, but free will, acceptance, respect, and understanding. A woman who you treat very well, a partner who you treat very well, let me be general, not gender specific, will reiterate and treat you well. And your children are learning how to behave in their own homes at that point in time. But there is no deliberate effort still. Because we still believe that those things are advantages.
Is that indicative of a personal responsibility of the man or the family? Because isn't it possible for a man not to even know that these weaknesses are obvious and so consequently should be something that his wife would be helping?
Because of what you said, that is why I think it has to be a government initiative to make sure that everybody knows their responsibility to being in a marriage and being in a family. Marriage is not the only way to create a family. People start families without getting married. That's not a problem. But if it's in our education, from the KS1 times, that is primary 1, or the nursery schools, bit by bit, what they need to know about marriage, then it becomes something that they have to do, to know. We go through education for 16 to 22 years, depending on the qualification of your degree that you get from where you are. And we are going to spend 2 to 3 weeks on marital knowledge. That just shows you what happens. We are in a society whereby unless the government says you must, we don't.
Well, again, it's one of those
Personal responsibility is not
that are endless and unwinding, because look at what is happening all over the world. Look at what is happening in even in our country, because it's a global village now. No, we can't really restrict anything to anything now, because what you do in your culture, you are likely to take elsewhere. And what is coming from elsewhere, you are likely to adopt without even understanding.
Checking it.
Which has affected us significantly.
A lot.
In our time. Thank you very much for your time this morning.
Thank you very much.
Mr. Deji, and we wish you all the best. And thank you for always coming around and every time.
Anytime.
We call. Yeah. Yes, our next conversation is an example. This patriarchal something. This next conversation, there has been an attempt to hold this man, but the man has been difficult to hold. Thankfully,
we have held him.
He has somebody that held him in the jugular. Sorry. We'll talk about that when we host our Artist of the Week coming up next.
Daddy, ẹ kú sí Olúwa sir.
Olúwa kú iṣẹ́ rẹ̀.
Ẹ kú sí Olúwa sir.
Ẹ pẹ̀lẹ́ sir.
Ẹ kú sí Olúwa.
Yes sir.
Ẹ má bínú pé mo interrupt yín.
Kò sí problem.
Jọ̀ọ́ lẹ́sẹ̀kẹsẹ̀, ṣé ẹ lè bá wa túmọ̀ fún ẹni tó gòkè ẹ̀mí?
Bíi ti báwo sir?
Bíi ti wípé ọmọ àbúrò ẹ̀gbọ́n ìyàwó mi ó gòkè ẹ̀mí, a nílò wòlíì tó máa bá wa túmọ̀ èdè tó ń sọ.
Oh, that is interpretation of tongues.
Tongues.
Mo mọ̀ ọ́ ṣe. Jíríkà sára, jíríkà sára.
Ó nìyẹn.
Ẹni ṣohun bẹ́ẹ̀, bá ti lo jíríkà sára mélòó kan máa parí ẹ̀. Ya. Ẹ pẹ̀lẹ́. Ọ̀nkú tó pè mí ìwà. Ẹ tún pé wòlíì mi.
Actually, ìyàwó mi ló pè. Ẹ̀yin lèmi pè. So ẹ bẹ̀rẹ̀ iṣẹ́. Ṣó wá rí kò lọ fà. Fóun lówó ọkọ̀ kó máa padà lọ.
Rárá ìfúnni. Ní máa padà lọ rárá. Pátákù pa ni. Pòròpòrò ń ta yín. Kí ló bá mi sọ?
Ṣó bá mi ń bì? Ṣó bá mi ń bì?
Tí bá wá gbẹ ń bí kọ́. Tí bá gbà yín bí kọ́. What a disrespect. Are you supposed to now ridicule my anointing? Kí ló bí sí?
Bọ̀bọ̀ yìí, ṣó nípè tó mi? Kí ló mean by ridicule anointing?
Èmi ló ń bá gbé tí mo nípè tó ẹ.
Ṣó nípè tó mi?
Bí mẹkáníìkì ló ń ṣe tẹ́lẹ̀. You are a mechanic before. I know you.
Ṣùgbọ́n Olúwa dẹ̀ ti pè mí.
Olúwa pè ẹ́.
Ṣé Olúwa ò pè mí ni?
Ẹ̀sọ́ wọ́n lè túmọ̀ èdè ni. Ṣé ọmọ èdè tẹ́mi gbọ́ ni?
Èdè mélòó ló gbọ́?
Èmi.
Èdè mélòó ló gbọ́? Mo fẹ́ mọ nǹkan tó jẹ́.
Maisabaya, number 1. Regelesi brataya, number 2. Zataya, number 3. Ikedu bariaba, number 4. Indi fleke mawobe, majamega jarija, number 6. Yaga sariya gege pariya gege pariya, number 7. Àti bẹ́ẹ̀ bẹ́ẹ̀ lọ. Tani ẹ?
Nínú Zataya yẹn. Zataya mélòó ló wà?
Èmi ló ń bi. Zataya live. Zataya ba. Zataya sa. Zataya. Máa fi èdè wúndù ẹ. Tó mọ̀ mi ṣá.
Tó máa gan. Má wọ̀rí. Mú ọmọ wá. Mo fẹ́ tún èdè, mo ti wà nú ẹ̀mí. Ẹṣẹ́ máa jọ ṣe ní bẹ́ẹ̀ àbá. Èmi máa ṣe. Ó dà.
Ọlọ́mọ ẹ̀ kò tẹ́ kúrò mi.
Lémi. Má.
And those who say it's been a while since they saw drama like that, fiery drama, like that. Well, that's the staple for our guest, who is Ayo Ajewole, a.k.a. Woli Agba, a prominent Nigerian gospel comedian, actor, musical artist, known for his unique blend of humor and faith-based messaging, primarily delivered in the Yoruba language. Good morning, and thank you for joining us this morning, Prophet Agba.
Good morning. Thank you for having me this morning.
Yeah. We were expecting we'll have you in the studio, but we'll make do with what we have. Hope you're well.
Thank you.
Okay. Let us start with that particular information. I usually, when I see an artist cry, They are acting. But the one that I saw, and I know you know what I'm talking about, it was not acting. You were acted upon. So, give us the backstory to it.
Well, it was a surprise birthday from my wife to me, and well, I think for her it's a time to celebrate because she has tried it like 3 times. But you know, as a smart prophet and as a smart person, I would always just get her. And so my birthday should be on the 28th of November. But she had to fix this surprise for 17th of November. So I wasn't expecting and looking forward to any of this. So the first thing she did was to give me a proud notice for about 2 weeks before that time that she got an engagement from a particular brand, that she would be cooking for a brand. So for me, it was going to be the first time I will hear that from her. But you know, my wife can be industrious, but I just felt maybe she just wanted to do that to probably just I don't know. When she told me that, I felt okay, it's not a problem. Just get your money, get paid, and that's okay. So she prepared my mind, and so every of their conversation, she had to talk to a particular friend that was calling her like they are trying to engage her. So she will tell them that she picks their fabrics for them, and then she's the one planning their event, and she'll be cooking for them as well.
And some of those conversations she was having with you.
Many times that she was with me, so that I would be able to listen to the conversation. But trust me, I was not concentrating. It wasn't really a big deal. Just do your business. It's not a problem. So then fast forward to the day. So the first thing they did was, before that date, she had to tell somebody to engage me for Monday, the 17th of November, 2025. So they called me and said, there's a particular man that loves to see me on screen. He's a very good fan of mine. And trust me, it's not the first time I'm hearing that kind of I'm hearing that kind of expression or kind of statement from people. They want to. I've been doing birthday surprises for people, and you hear wives or husband calling me that they want to use me to surprise their wife, or use me to surprise the husband. So it didn't sound new to me. So I felt okay, it's not a problem. So the next thing he told me was, how much would I collect? That I should just take 1 million from them, and that the woman just want to do it that way, just for me to just come in for 15 minutes. The man loves me. He loves to watch my video, to see my video. This were not sounding, nothing was sounding so new to me. Everything I've had it a long time. I've met my fans that really want to see me, you know. So it took like in like 10 minutes, I got the money already, so it was fixed. So she had to pay me. She gave me 1 million naira to come for the event on Monday. So I got dressed. They called me that they were waiting for the chairman because there was heavy traffic in Ibadan that day. So I guess most of the guests they were planning to surprise me with were still stuck in the traffic. So they had to reach out to me that I should please still delay my coming. So I said, no problem. They gave me a time to come 4:30 p.m. I said, it's not a problem. So fast forward to the fact that they even went as far as doing graphics. They called the man Akin. In fact, there was I'm sure there's a man called Akin Fajemibimo. So that was the name of the man. They did graphics, but there was no time, there was no venue. They texted me the venue, but I saw the graphics so it was a sent forth program. So I saw all of that, Akin Fajemibimo. So I said, there's no problem, I'll be on my way. So he called me, said I should start coming. So when I was on my way, you know, the person that was going to do the anchor, the person that reached out to me actually. So I know him too. I know him so well. His name is Rotimi Johnson. So when I was on my way, he told me to please ensure that when I'm like 2 minutes to the place, I should call him because they reserved a particular space for me. The whole place was blocked, and they wanted me to just park in because they as a guest. So I was cooperating because at least they want to use me to surprise somebody. So I wasn't even thinking about it. Little did I know that even the guys that were taking me in my car, they were communicating to tell them my location. Well, I was also surprised that the rate at which the guy driving me was moving fast that day, I was almost going to say, Joe, she will not pay. She will not pay. If you not pay, there's something more country. Like, you can just move at my pace. So the next that happened was I got to the venue of the program. This MC had to rush to me and said, I should pronounce the name well, because he made a mistake. He's been making mistake pronouncing the name. That the name is Akinfajemi Bimo. I should not forget. I said, no problem. That was what we're still discussing till I got to the entrance. So when I saw, the next thing was, I said, Akinfajemi Bimo. That's an Ijesha name, Akinfajemi Bimo. So on getting to that point, I just saw a crowd. Yeah! I can't tell you what I had was surprise. What I had was, yeah. I was still wondering that, was it that the man loved me this much that they had to arrange for people to welcome me, or what's happening? So I didn't get for like few seconds. I'm still yet to connect the dots. The next thing was I saw my wife coming in the midst of the crowd. Because she had told me before, you know, she gisted me and said, what if the company she's been preparing for, what if it's the same place I'm going to? I said no. I asked for our own location. She told me, and I told her my own. So it was a different location. So we had the conclusion that we were not going to meet at the program. So when I saw her brought bouquet to me, and I was just still wondering, the next thing I started seeing, the person that revived me was one of my staffs, because she was in the office when I was in the office. So seeing her in their attire, their outfit, the outfit they picked, they went as far as picking outfits. Oh my God, that thing broke me. They went as far as picking outfits. So when I saw her, I was like, I saw this lady in my office this morning. Why is she here? Because I asked after her before leaving the office. They said she stepped out. So seeing her, that revived me that, okay, this is going to be a surprise birthday. Okay, but I wasn't expecting anything too big that I have the likes of Dr. Yinka Ayefele, Mama Bola Are, Tope Alabi, Esther Egbekele, T. Pompey. And you know, these are people that are quite big for me. Mr. Johnson, Femi Adebayo, Sikira Tusindodo, Femi Sola, all of them, you know, Kenny Black. I saw a lot of people, and these were people I saw the previous day. We were at an event together. I was at an event with Femi Adebayo on Saturday. On Sunday, I was at an event with Kenny Black, all of Kamo State, all of them. Me were Demola. So seeing all of them, I don't know. I could not help it. It was too big for me. It went like Mofe, like in compare wrong because what like taking like you. If you say like let's be surprised, oh God, look at me. I could not control my tears. I was trying to maintain my speed, but my composure left me. I could not. I was trying to say, even in the outfit of Woli, am I supposed to disappoint the host of heaven and I'll be crying in this outfit? But this was really too big for me. Please. Then I was even trying to monitor the shape of my mouth. But at some point, because that was my mom. My mom was there, my sister from Lagos. She practically picked everyone that she knows that if I see these people, and for me, we went to, and they picked clothes. The ladies were wearing wine. The guys were wearing blue. And oh God, for who? So I could not just control the tears. I had to bomb Okunrinje. I said, you know what? Apologies to all the prophets in the world. One of your prophets is about to cry. I said yes. I cried so much that the night of that day, my wife was asleep beside me. I was looking like, I didn't win again. You know, it's too much. You like taking like you. I had to hold. I was like, Kilo de bed. This is too much. Then when she brought in Tope Alabi, these are people that I value so much, and I know what it will take for them to leave the other programs. I just appreciate. And they were there waiting for me for 3 hours, 4 hours. For who? Me, Woli Agba. It was really too much for me. Esther Egbekele. I can go on and on and
I can people, just imagine.
You know, the brands I represent, a lot. Everybody was there. And even people that could not meet up, it was a time that I would never forget.
Right.
It's a lifetime gift from my wife. For me, because I did not need to contact them myself. He was able to give my wife. She had the privilege of knowing that every time I told her I was going for an event or that I know these people, it was a time for. What if I've been faking it that I know them, and she just had to pick my contact. She just because we had a shared contact on my phone,
right?
So we had our contact. She gets access to my contact, so she had to just message them privately. What if I've been faking it all along that I know them? What if I'm not what I am? So the fact that I had a zero knowledge about all of this, and she contacted them herself. And she said nobody gave her problem. That at the mention of the name Woli Agba, the next thing is, please send me the location, make sure I am there.
Right.
I need to be part of this.
Okay.
And it's a gift of a lifetime.
I can just
gift
imagine.
that I would never forget. And trust me, I'm still looking for a way to do my own back.
No, you will do your own back. You will do your own back.
I don't know these people to
Don't worry. You will do your own back. You will do your own back. Calm down. Calm down. Calm down. Calm down. You will do your own back.
You'll be part of my doing back.
Okay. But we don't have so much time, but it just tells one thing. This tells me, even though your wife was able to contact people and bring everybody together, it tells me of the unity and camaraderie that we find in the entertainment industry. People were willing to sacrifice all to just say, if it's for him, I'll do it, don't worry. Tell us about this camaraderie, unity in the entertainment industry that has affected you positively all these years.
Thank you. Were you trying to ask a question?
Yes,
sorry,
I'm asking
I didn't
you.
Get that question?
Yes, I was saying that it tells me about the camaraderie and the unity in the entertainment industry for people to be willing to drop everything they were doing for you, to celebrate you. So how has this impacted you positively, over the years?
Aside from coming for your surprise party.
Aside from coming for your surprise party, that's it.
All right. Well, I think you're making a very cogent and crucial point there. The fact remains that, even for all of this, their event, you just hear, I want to have a movie premiere, I need you around. When artists come out for artists, you break the protocols and the rules of trying to send them modalities or what it will take to have me there. There's a way we do it for ourselves when it comes to artist, entertainers to entertainers. So we break protocols. We break protocols for ourselves. It's a time for us to come together and to relate, to know that I still did there. People still they come up for me. So one thing this has contributed to me is, first, I was telling somebody, I said, what my wife did is just probably to revive me. You see, as an entertainer, if care is not taken, it feels like you are the only one just running. Everybody's just taking your content. It's a privilege for me to at least, it was a privilege of feedback. She gave me like a feedback. I told somebody, I said, my wife revived me. It was more like a revive, because it's not easy to just be putting out content there all the time and you don't get the feedback of love, of appreciation. I know my fans appreciate me, but some people already got used to the fact that this guy is funny. But, he gave a positive impact to me. Like, I have this kind of great feelings of revival, of hope. Like, okay. And then the fact that it showed to me that everyone is watching, even if everyone is quiet. It showed to me that you are not just here all alone. It showed to me that people really appreciate me so much, And it gave me the privilege of touching the heart of people, the minds of people. To me, I was like, it got to a point. I asked severally that, were you going to another event? They said no. They came for my event. That's why they are wearing my clothes. I saw. Now it's my clothes.
I saw that.
So it has a beautiful and positive impact on me, and I must say that entertainment industry is so blessed. And for this major fact, just always know that let me say to Yoruba, ore lore water. That's the way it works for us.
It's second nature to you to do that, Woli Agba. So we know you will always do that. But you know, I want to, you know, what you said now about paying back. We have an opportunity for you. Don't worry, we'll give her. It's going to be a different surprise for her. Don't worry. December 27, we have here at Channels Television what we call DSS, and you'll be under arrest. Don't worry. Okay. It's December Sunrise Special. So your wife is going to come into the studio. We're gonna between you and I, we're going to discuss how we're going to pay back. Because everything that when you receive product, you have to be paid back. So we're going to talk about that one later. And I want to believe that you are in on that one. We don't really have time. I really wish we had at least 30 to 45 minutes to have this conversation with you, but for the exigency of time. Thank you so much for your time this morning. Ayobami Ajewole Woli Agba, prominent Nigerian gospel comedian, actor, and musical artist, known for a blend of humor and faith-based messaging. Thank you again for your time this morning.
Thank you. I appreciate you. Thank you so much for having me.
Yeah.
Thank you at home for your time.
One of the things we're going to have to learn is we need to brand that product. How to surprise your spouse.
Yes. How to surprise your spouse.
Yes.
HTSY.
Here they go again.
HTS.
How we need to create that. You're writing it already. Wait now.
Write it down.
While you are writing it, thank you very much for the privilege of your day. Being a part of your day.
No, we have to register it.
Okay. I'm Ayobakide. Enjoy the rest of your weekend and bye for now.
Bye.